Hello, welcome to the first virtual symposium advancing the science of scientific publishing and the call for research and abstracts for the 9th Peer Review Congress. I'm John Ioannidis from Stanford University for the Meta Research Innovation Center at Stanford and co-director of the Peer Review Congress. And I'm shared in this panel by valued colleagues, as you can see on your video screen. Mike Berkowitz, Godlee, Catriona Chatfield, Theodora Bloom, Annette Flanagin, David Moher, Veronique Kiermer, and there is a chance that my good friend and colleague Steve Goodman may also join us later. Let me share my screen for a few introductory remarks. This session will be recorded and it will be made available eventually to participants, to those who have registered. And you can go to the website at peerreviewcongress.org. As a reminder, participation should be respectful, professional, ethical, safe, and welcoming. We plan to run this symposium like any peer review Congress session. There's a very long tradition on this with equal time for presentation and discussion. We encourage questions. Please keep asking, and also please keep your questions brief and to the point without lengthy explanations or speeches. All questions should be posted only to the Q&A section, which you can access from the bottom of the Zoom screen. If there are any questions that we do not have time to address during the symposium, we will provide answers following this symposium. What is our aim? Our aim for this symposium, which is a pre-meeting for the Peer Review Congress, is to encourage research into the quality and credibility of peer review and scientific publication, a very hot topic nowadays, a very hot topic even more so than previous times, to establish the evidence base on which scientists can improve the conduct, reporting, and dissemination of scientific research. And of course, you're welcome to share and comment via Twitter with the hashtag PRC9. But do remember that all questions should be directed to the Zoom Q&A. The panelists I have already introduced, Mike Berkowitz and Annette Flanagin are from JAMA and the JAMA Network, Godlee, Theo Bloom, Catriona Chatfield from the BMJ, Veronique Kiermer from PLOS, David Moher leading the Center for Journalology at Ottawa Hospital Research Institute, Steve Goodman, my colleague at Stanford, and of course, Drummond Rennie, very special person for all of us and for the Peer Review Congresses. He's our Director Emeritus and founder of the Peer Review Congresses. We're very, very lucky to have an amazing team of advisors that cover a very broad spectrum of international leaders, of editors, of researchers who represent very different disciplines. And it has been a great pleasure to work with all of them, trying to materialize what I think will be a fascinating meeting. We are also thankful to a number of sponsors who have been supportive of our work trying to organize this conference. There's a very wide agenda that the Peer Review Congress will try to cover, and you will get some sense of that agenda in this webinar. Here's the list of topics that our panelists are going to cover, including how lots of hot topics in peer review and publishing, including how the pandemic has affected peer review publishing and the dissemination of science, with challenges for research, inclusion and diversity and bias in peer review and scientific publication, why this is important and how best to study, new forms of reporting science, ensuring the quality of reported science and reporting guidelines, testing of innovations in peer review and publishing, how to do it right, call for abstracts, suggested topics of research and types of research and methodologic rigor to consider when you submit your work to the meeting. So at this point, I would like to thank you again for joining us and continue with our next speaker. Annette?
Yes, thank you, John. I'm sharing my screen. Can you see it?
Yes.
Yeah. Okay.
Yes.
Excellent. Thank you. Thank you. These are my disclosures. I'm going to be talking very briefly about the history of the Peer Review Congress, which is now well into its third decade. The first Peer Review Congress was announced by its founder, Drummond Reddy, in 1986 in an editorial called Guarding the Guardians. The goals then and now are to put the processes of peer review and publication, the so-called gatekeepers of science, under the same examination we require of science itself. To stimulate research into peer review and scientific publication, to facilitate the evaluation and testing and discussion of such research, and to foster publication of the results of such research. There have been 8 peer review congresses held since 1989. These are on a quadrennial cycle. They're held every 4 years, except for this year during the pandemic. And you can see here the years that have been held, the locations, and the growing number of submitted abstracts and abstracts presented over time. We also broadened the title of this Congress from biomedical to scientific to encourage the diversity of disciplines represented and the diversity of participants. You can see the number of participants has increased from a little under 300 in 1989 to nearly 600 in 2017. And in that year, they came from 38 countries. This shows a small descriptive analysis that Drummond and I did after the 6th Peer Review Congress. We were wondering what was happening with that goal to stimulate research and to stimulate the publication of research into peer review. And what you can see here are ebbs and flows somewhat loosely associated with the actual congresses of articles cited in PubMed or indexed in PubMed under the term peer review, and then under the term peer review research, which became a formal mesh term in 1994. What you can also see here is when the congresses first began, the world's literature on scientific peer review and publication amounted to less than 5 articles a year. This rapidly changed by 1999 and was around 200 articles that year. What I find interesting as well, if you look, I haven't tracked this yet, but after the 7th and 8th peer review congresses, we saw continued sort of spikes in the numbers of PubMed articles on peer review and research. But the last 2 years, we saw lower numbers in 2020 and 2021. And while this could clearly be a natural dip associated with the peer review Congress, it is also likely representative of a diversion of research into the COVID-19 pandemic that I'm sure we've all seen. This is a snapshot of the topics of research that have been presented at the peer review congresses over the last 3 decades. In the beginning, we had some invited talks, 10 on the first Congress. Now they are limited to 3 to 5 per meeting. We began with a number of standard topics on editorial and peer review, the process of both, bias and publication bias, quality of trials, quality of trial registration, and we've begun to see a spike in quality guidelines and standards. And you can see that with the last 2 bars there, reflecting the last 2 congresses. Mainstay topics have been on authorship and contributorship, conflicts of interest, integrity and misconduct, editorial policies and practices, online publication tools and features, and ethical issues. We're beginning to see more in more recent years, more studies of the effects of citations and indexing and post-publication peer review, publication timeframes and pathways, and the quality of news media. And after much pushing, we began to see more research into grant funding, peer review, and those policies. And most recently, in the last two congresses, research on the effects of social media and preprints. In the 6th peer review Congress, Drummond Rennie asked this question: have the peer review Congresses represented a victory, a defeat, or both? After that Congress, Mario Malecki and colleagues analyzed 614 abstracts that were presented at the 7 previous Congresses. And they descriptively found that 76% were observational studies, 16% were studies of interventions aimed at improving peer review and scientific reporting, and 8% were opinion presentations. Those were the invited talks. At that 2013 Congress, 27% of the 110 presented studies were interventional, including 5 randomized trials, which marked progress. 305 or 61% of the presentations from the first 6 congresses were subsequently published, which is akin to what we see of abstracts presented at major scientific meetings in terms of publication rates. Of the 294 articles published after presentation at the 6 congresses, Malicki et al. Found that 36% reported being funded. This increased to 41% of those abstracts presented at the 2013 Congress. Malicki and colleagues concluded that interventional studies aimed at improving peer review and scientific reporting are still underrepresented, and systematic approaches and funding are still needed to further improve research into peer review and scientific publication. So to answer Drummond Rennie's question, have the Congresses represented a victory, a defeat, or both? Well, there's been some defeat. We've exposed failure, weaknesses, and need for more evidence. There have been a number of victories as well: improved reporting standards, greater transparency, and better science. And to paraphrase Drummond Rennie, despite this growing evidence that peer review is blunt, inefficient, and an inexpensive tool, most of those involved want to keep it, believing that the alternatives are worse. The peer review congresses have encouraged research to evaluate and test attempts to modernize, open up, and improve the effectiveness of peer review and publication. Here we see the good ship peer review maneuvering through icebergs of expense, delay, bias, anti-innovation, and conflicts of interest. And to this, we should add misinformation, predators and pirates, and now the COVID-19 pandemic. All of these are excellent topics for research for the next Congress, but they're just ideas. The ideas for research will come from you, the participants, and that will actually fuel the program. An important improvement that we've seen has been the participation of women at the Congresses. In 1989, during the first Congress, of the 24 plenary abstracts that were presented, there were only 3 by women. At the 8th Congress in 2017, of the 50 plenary session presenters, 58% were women. In addition, 7 studies at the 8th Congress evaluated the role of gender bias in peer review conducted by journals and funders. And we'll hear more about that shortly. Our continued goals are to improve the rigor of research and expand diversity and inclusion in terms of research focus and participant representation by scientific discipline, geography, race, ethnicity, and career stage. Thank you. And John, I'll turn this over to Fee.
Thank you very much, Annette. I've been asked to talk about why the peer review Congress matters, why it's important, and why indeed it is unique. So I'll just whiz through in 5 minutes the why, what, who, how, and when of the peer review Congress, which has been a major part of my personal development as an editor. And I know that there are many who could say the same in whatever field of endeavor they are involved in. So we've heard about the why, what's the aim: to encourage research into the quality and credibility of peer review and scientific publication, and to further the evidence base on which scientists can improve the conduct, reporting, and dissemination of scientific research. And as has been said, who guards the guardians? If peer review is one of the major guardians of reliable and relevant research, who guards them? We too must put ourselves under the scrutiny of science and test and challenge and improve the standards of peer review and scientific publication if we are really doing the job that we are meant to be doing. So what is the Congress? And you've heard already a bit about it. It has traditionally been 3 days of presentations. It's been a great shame that it hasn't been able to happen as planned this year. Presentations of original research about processes, problems, and innovations relating to peer review and publication and knowledge dissemination. I think as Annette has made clear, one of the great things about the Peer Review Congress is that it stimulates new research. So the call for papers itself is a stimulus for people to go out and do research. And certainly from in my experience, it has been a major stimulant and prompter of people to get busy looking at data and doing intervention studies as well. And this is what's built the evidence base over the years. And the other purpose is that it holds and shares the growing knowledge base so that at the Congress we bring together those who have historically or traditionally been closely involved in this with new people who want to get involved. The who of Peer Review Congress, well, it's a unique mix, and the list of potential attendees is long. Editors, publishers of scientific peer-reviewed journals, researchers, funders, bibliometric and informatics experts, information innovators, librarians, journalists, policymakers, ethicists, scientific information producers, and disseminators, and indeed anyone interested in the progress of the scientific information enterprise and improving the quality of scientific evidence. And these people, increasingly over the years of the Congress, have extended well beyond healthcare, where this, of course, all began, to include disciplines such as biomedicine, health and life sciences, applied sciences, basic sciences, physical and chemical sciences, mathematics, computer sciences, engineering, economics, and social sciences. And of course, we are welcoming to new and emerging disciplines as well. So we've heard also a bit about how it's run. The tradition has been, to its great credit, that equal time is given to the presentations and to the discussion. So it is a real forum for debate. And then there are some challenging and topical plenary sessions from great speakers. Abstracts will need to be submitted and peer reviewed, and priority is given to novel data-driven studies, providing rigorous evaluation of old and new processes with a broad range of study designs, especially interested in those studies that build on existing research and are generalizable across disciplines. I should say that one of the great joys of the Congress has, in my experience, been the networking and the exchange across disciplines, and the opportunity to meet old friends and make new ones, and to generate research collaborations, many of which have found their beginnings at the Peer Review Congress over the years. Finally, the when. So September 8th to 10th, 2022 are the dates in the diary, and abstract submission opens on December the 1st, 2021. So not a lot of time to pull together your research projects, but I hope you'll all get busy. And I hope those listening will respond, yes, by doing original research in your disciplines, and that as many of you as possible will join us at the meeting. Do spread the word to your friends and colleagues. Thank you very much. And with that, I'll hand back to John.
Thank you, Fee. We will proceed with discussing hot topics in peer review and publishing. There's going to be 5-minute presentations followed by Q&A. And Veronique is the first to present on how the pandemic has affected peer review publishing and the dissemination of science. Veronique, all yours.
Thank you, John. And I hope you can see my slides and hear me.
Yes.
So, perfect. So studying how the pandemic has affected both peer review and the conduct and dissemination of science is actually very important in particular, so that we can learn from these experiences, and that if there have been successes, that we actually maintain these successes beyond the pandemic, or that we design better interventions than the one that we've used to try to mitigate the challenges. And importantly, that we continue to be watchful for new forms of biases that may have become evident. So we will welcome such studies that can inform these lessons going forward. In the few minutes I have, I'm going to set the stage by describing the challenges that we've observed, and hopefully highlighting a few potential topics of interest that would be considered. Obviously, it's not going to be exhaustive. As Annette said, you will be driving the agenda, but I'm going to focus on these two topics, and starting with how the pandemic has challenged peer review efficiency and effectiveness. So shortly after the outbreak of the epidemic, many publishers have seen a very strong influx of submissions of COVID-19 research. And that created a very strong tension because on one end, obviously everyone was very conscious and recognized that speed was of essence. It was very important for publishers to rapidly peer review, vet, and disseminate this research so that it could inform care and interventions. But on the other hand, there was a huge volume, and many publishers have attested to the fact that the quality was really mixed. And that may have been because people were shifting and pivoting their research programs to COVID-19 with very little previous experience, or simply because the doing research in these conditions was extremely challenging. And so meanwhile, the experts that our systems typically rely upon to vet the quality of research, these experts or peer reviewers and editors were experiencing the exact same reality. Many of them rightly and understandably focused on research and clinical care, and those who were available actually became overwhelmed really quickly, and that put a real stress on the system. So there's been some creative interventions. I'm mentioning just one for illustrative purposes here. But I think it would be very important to understand how this tension has affected the record quality, what interventions were effective, and is there evidence that we've learned there that we can actually introduce to maintain efficiencies beyond the pandemic. Obviously, the challenges were not limited to COVID-19 research. Across the spectrum of scientific disciplines, researchers experience really practical limitations with lab in lockdowns, field studies interrupted, clinical trials on pause. All of these demanded adjustments and interventions. And again, a couple of interventions are mentioned on the right-hand side here for illustration. And also, you know, in terms of availability of reviewers and editors, even those who weren't working on COVID-19 really had many other demands on their end, right? I mean, a lot of people had to shift to online teaching, for example. So all of that affected the availability of expertise in the system. And then, regardless of their roles in the process, author, reviewers, editors, even professional editors, many scientists and experts were actually also caregivers. They were tending to the needs of sick family members, they were homeschooling children, and that has exacerbated some biases that already exist in the system. And for example, there have been reports that have highlighted that the pandemic has disproportionately affected women in science and engineering. So it will be important to understand these biases, to understand whether they are new biases, and to really design intervention to control them. Moving on to the second topic of how research is conducted and output shared, I'm just going to draw up two themes here. The first one is the dissemination of before peer review. And we've seen during the pandemic an explosion of use of preprint servers in biology and medicine, which had not been seen before. It certainly has had positive impact via the rapid, unrestricted dissemination of research findings, but it's caused some challenges for communication to the public via the press, for example. It's had implication on policy making. And then we've seen amazing examples of the community either through an organized system or spontaneously coming together to peer review preprints. On the other side, on collaboration and sharing, funders and many institutions, other organizations called early on for sharing of research data, for example. And certainly, we've seen examples of research that has been accelerated tremendously through international collaboration, open sharing of reagents, data, code, protocols. But we've also seen evidence that there is actually quite low compliance with data sharing requests. And there's been examples of data from critical studies that was not available and compromised evaluation and trust. We've all seen examples and anecdotes of that. And I really hope that at the peer review Congress, we will see robust evidence analyses of these effects, whether they're positive or negative, so that we can really inform the future of how research is disseminated in pandemics, but also beyond that. And so I'll stop that and open for questions.
Thank you, Veronique. Michael, do we have questions?
Yes, thank you, Veronique, for a wonderful presentation. There are no questions yet specific to your presentation in the Q&A function. We are at 320 participants. We're expecting upwards of 1,000, so perhaps they will come in, but I encourage you to ask your questions of this esteemed group of panelists while you are listening. I thought I would kick things off, Veronique, by asking you about this notion of research waste, which is near and dear to the Peer Review Congress. Our colleagues and some of the patron saints of the Congress, Doug Altman, Iveta Simera, Paul Glajou, Ian Chalmers, have talked about up to 85% of research being essentially inefficient, which is what you're speaking to. And I wonder if you could speak to that with respect to COVID, where many people were kind of submitting lots of casual observations about the emerging pandemic, how you experienced it at your journal, or whether you can speak about that more generally.
I think, yeah, it's a great, I mean, obviously it's a great question, because I think the pandemic, research waste is something we see in general. And I think the pandemic has thrown that in sharp relief in some fields. And I think that, you know, as I briefly alluded to, in our experience, what we saw was two things. On one end, it was people wanting to contribute, and even people who were not coming from a field of expertise that was absolutely related to that. And so we saw a lot, for example, of computational studies very early on, which were reusing data and doing from people who were not epidemiologists or from different sides. And I think that has created a lot of noise in the system. Some of these studies were incredibly important and good, and some were creating more challenges for reviewers and editors. So I think that that was one example. But the other side is also that during the pandemic, designing a very careful study, properly controlled, was also quite challenging for people who were, you know, at the cold front and really dealing with the pandemic on a day-to-day basis. So I think that we also had to be mindful that information that studies might not have been designed ideally, or that, you know, additional data points and could not be collected because of the situation in which the studies were done. And so, you know, you've seen examples of people coming together to provide guidelines on how report clinical trials, which outcomes had been changed because of the circumstances. So I think that there's also been a lot of adjustment there, and we've needed to have really thoughtful consideration of what was ideal, what was wrong, and what was just realistic, and that we had to actually. And so I think the answer in those cases have very much been reporting transparency, being very upfront about limitations. And I think that may have helped, but it would be very interesting to see studies of that in more quantitative and qualitative terms.
I agreed. We have a question in from an anonymous attendee who says, I am an individual researcher from India. How can I publish research papers working as an individual in this pandemic? Things have become much more difficult. I'm wondering what advice you could offer that viewer.
I think it is absolutely true that collaboration has been a really strong driver in this pandemic, and that people trying to do individual researches have been are really challenged, and so finding collaborators and working in tandem with others, you know, has been very important for many people. And I think that we've seen things I'm really curious to see, for example, and would love to see research on that at the Congress. Whether there has been more reuse of data, for example, because people could not generate their own data and experiments, but had to be using other people's data, which would also help with waste and things like that, or could be problematic in different ways. So I think that you know, advice for people is to find collaborators where possible, and to be very transparent and obvious about limitations. And I think that's the only thing I could say.
Wonderful. I think we're at time. We're getting many excellent general questions about the Congress, and just for anyone who's viewing, keep those coming, but we'll probably address those general questions towards the end of the webinar. And John,
Thank you, Michael.
I'll hand it over.
And we continue with Cat Chatfield, who will discuss inclusion and diversity and bias in peer review and publication. Why is it important and how it's studied? Pat, the field is yours.
Thank you so much. I'm just going to share my slides. Hopefully you can all see those. In terms of my disclosures, I don't have anything to disclose beyond my employment at the BMJ and the BMJ. So the first question, why is equality, diversity, inclusion important in scientific publishing, and why should we study it? And I think the question for me is, how can we reflect on how scientific publishing perpetuates social injustice in the form of a lack of diversity and a lack of inclusion and equity? We know that improving diversity and inclusion contributes to the quality and innovation of research. We know that it inspires the next generation of researchers, and yet it's something that we are currently struggling with across scientific publishers. There's also a link between inclusive cultures in organisations and organisational performances. So there are lots of drivers for us to improve equality, diversity and inclusion. So beyond that, I would say there's a moral imperative to improve diversity and inclusion. And by not doing so, we are perpetuating this social injustice. And as you can see in this slide, reflecting on the role of journals and editors, it's complex and sits within the research ecosystem. So what are some of the challenges that we encounter when we think about studying it and generating evidence about what interventions are truly efficacious and lead to improvements in outcomes for authors and researchers who are underrepresented and underrepresented communities? I think the main question for me is, what aspects of diversity are we talking about here? I think it's common for us to talk about gender, partly because it has become easier to describe different categories of gender. The sort of data seems a little bit easier to garner. It's perhaps a bit more socially acceptable to ask people about their gender identities than it used to be. There's of course an increased focus on ethnicity, with lots of big social movements focusing on this, and Black Lives Matters and beyond. But what about other types of diversity and inclusion? What about our LGBTQ+ scholars? What about our scholars with disabilities? How are we thinking about inclusion, diversity and equity in an inclusive way? And can we be really ambitious with the way that we do that within publishing? As I said, there's interdependency with bias in the research ecosystem. If funding is biased, if academic tenure and progress and publication is biased, then you're going to have this vicious circle where it's more difficult for these underrepresented groups of authors and researchers to even undertake their research, let alone get it published. So these are quite tricky things for us to unpick, and we need to be conscious of that when we're studying the impacts of publishing editorial and peer review processes. There's also this profound challenge around how do we collect this data in a way that is appropriate and sensitive. In many countries, this data is protected by special laws, certainly in the UK, these are protected characteristics. So we have to be really mindful about how we ask authors, reviewers, and editors for this data. There's also real challenges around categorizing this data. So there is no international consensus about kind of categories of ethnicity, and the types of ethnicity categories that we might ask people for in the US, for example, are very different from the categories we might ask people for in the UK. This is something that we are working on collaboratively across scientific and beyond, publishing and beyond, with a coalition of publishers who are working to improve this, but it's certainly proving to be a big challenge for us, let alone other researchers. There are obviously issues about how this data is protected and handled, and this real challenge of how do we separate this data from editorial process so that our authors can feel sure that they are not being disadvantaged in the editorial and peer review processes by sharing this data. But on the other hand, we can also measure the impacts of interventions that we make to try and improve diversity and inclusion. So that's a real tension in this field. What outcome measures are we using to study this? What does reduced bias actually look like? There's a lot of process measures that we can study, but outcome measures are more difficult and more complex. Also, if we are talking about kind of cultural change, the complexity of how we measure and assess that as well. there's a lack of existing evidence base about appropriate interventions that really improve diversity and inclusion. And there's also a challenge around understanding what the appropriate research methodologies are here, going beyond those observational studies that we've heard about, which predominate, but thinking beyond not just randomized controlled trials and study designs which demonstrate causality, but thinking about drawing on improvement and implementation science methodologies as well, to allow us to look at and study complex interventions with multiple strands, and also to look at data and trends over time. So how can we do this? I mean, our first step is absolutely to understand the baseline, which is this kind of observational approach, but we do need to know what our current demographics are, how these relate to our current processes and outcomes, and what the qualitative data might be on our barriers. However, we want to go far beyond that, and we want to study interventions that we might make throughout the editorial process. And these are lots of interventions that have been suggested, but they've been little studied and evidenced. So there's ranges from various points in the process, from does increasing the diversity of membership of our editorial boards actually reduce bias in editorial decision making? How might our editorial policies adversely affect diversity? For example, if we choose not to accept work in translation, what's the impact of outreach? What's the impact of commissioning targets? I'm not going to go through these all one by one, and what approaches to peer review foster inclusion and reduce bias. We have had a strong move towards open peer review in the past, but now there's a question about whether anonymized peer review is actually preferable. So that debate has raised its head all over again. So lots of areas for you to think about studying, and sharing this evidence with us at the next congress, and I really look forward to hearing it. Thank you very much.
Thank you, Kat. Michael, do we have any questions?
We have one question related to that presentation. Thank you, Kat, for a great kind of roundup. An attendee says, I feel the underlying problem is a bit different, namely the lack of inclusion and diversity in science itself and in study designs. How do you feel peer review can influence that lack of diversity?
Absolutely. And I think that's the point I was trying to make in my opening slide, where, there is this real interdependence with the research ecosystem. So it's very difficult for us to look at this in isolation. I think it's not just the peer review system that we can use to influence this, but it's the whole publication process, as a lever for influencing change inside the research ecosystem. Publication currently is an outcome that's desirable for authors and researchers, and that gives us an opportunity to set expectations, requirements for example, inclusion of authors from the Global South when we're commissioning work, or as we've done so much work on it at the BMJ and patient partnership work, we now mandate, when we commission certain types of content, we mandate patient co-authors, we mandate statements in research that says how patients and the public were involved in the design of the research, how the research is going to be disseminated. So I think we can build on these interventions that we've already shown to have effect on driving change within the research community, but look at them through a diversity and inclusion lens.
Wonderful. And a follow-up question from another viewer. This could be interpreted a number of ways. Go with it, do with it what you will. Can you share how you're addressing the challenge of different ethnic categories in different countries?
Yeah, so I mentioned this coalition of publishers that have come together with, I think, around 40 publishers now from different countries, and predominantly English-speaking countries, but certainly the BMJ and JAMA are both participating. And essentially, it's what we're doing is sharing all the work we've done together. We've come up with a common list of terms that we think may be kind of more broadly applicable across different countries and settings. We're currently checking those out with some expert consultants who work in the field of diversity and inclusion, and that's being hosted by one of the publishers who've entered into a contract with such a consultancy, and then we're going to try and test them out with our users and authors and researchers and see whether they are acceptable, how well they fit people's needs. Of course, there's always open categories, and we want to enable people to self-define their ethnicity, but that does make it challenging when we come to interpret the data and to draw comparisons. So there again, there's that tension.
Wonderful, thanks.
Thank you.
An anonymous attendee says, given the scarcity and lack of diversity of reviewers, what efforts are being made to actively and deliberately include early career researchers such as grad students and postdocs into reviewer pools, especially given published data that they are already participating in peer review in hidden roles, for example, by co-reviewing with invited reviewers without the explicit knowledge of editors?
I mean, that's a really good question. I'm not sure that I am the right person to answer it. I think journals are always consciously trying to expand their peer review pool. And I think for me, it's an obvious place to look for early career researchers and, a natural way to improve and build on diversity and inclusion. I think the question that I really would like to see answered, as I said, is does that help? If we do improve the diversity of our peer reviewer pools, does that actually how does that impact on the work and the research from authors from underrepresented groups? I suppose that for me is the should we do it as well as the how we do it, I guess. And I think the answer is, of course we should, but I think it's important for us to test out those assumptions.
Right, and Annette in her opening presentation called out career stage as a parameter of diversity, which editors at journals should be thinking about.
Yeah.
And all I can say anecdotally is that I, as an editor who assigns papers for external peer review, will often say, please invite a graduate student, a fellow, a trainee to assist you, particularly if I think that will increase maybe chances that that there will be a transfer of knowledge and also a review from another otherwise busy review.
Absolutely.
Thanks much. I think that's it for the specific questions. I'll hand it back to John.
Perfect. Our next presenter is David Moher. David is going to discuss new forms for reporting science, quality assurance issues, and reporting guidelines. David, the floor is yours.
Thank you, John. I'm going to just share my screen now, and hopefully everybody can see that. Happy Tuesday to most of you, and thank you all who have come on today. I will just present some disclosures that I have. I thought I'd start by sort of talking about registered reports, which were introduced by Chris Chambers in the journal Cortex as a possible way to reduce publication bias and reporting biases. And they're a really interesting introduction. They have now come across on several disciplines, and it would be really interesting to have people present at the Congress as to, indeed, do they reduce reporting biases, and do they reduce publication bias? We've seen some initial work in this area, but I hope that the Congress will provide folks with a lot more opportunities to look and see whether they are effective. One could also ask the question as whether registered reports differ in terms of their success across disciplines, and even ask about their implementation. How have journals implemented them, and have some journals be more successful than others? That would be sort of really interesting and informative research as registered reports continue to grow in numbers and across disciplines. Since the pandemic, there has been really an enormous increase in the number of preprints, no doubt exacerbated by COVID-19. The advantage of preprints might be their sort of equity and people being able to look at them, review them, not based on whether they have money to access particular websites. The question is whether preprints, having not had the formal peer review, whether they're of equal quality and whether they have more biases associated with them, and what sort of quality control is taking place with preprints. All of that research seems to be really of tremendous interest to the Congress. One could think of both experimental and quasi-experimental and observational research to actually look at preprints. One could look and see what sort of policies journals might have about preprints. Are they similar across disciplines? And the third sort of type of reporting I'll briefly discuss today is predatory journals, which have seen an enormous sort of increase in their last decade. The question is, for example, we know that initially people were using predatory publications in promotion and tenure. Is that still going on? Is it a bigger problem? Is it a smaller problem? Does a problem differ across disciplines? Are predatory journal articles being included in health policy documents? These are all researchable questions and questions that might be very suitable for the Congress. And what do we know about sort of reputational risk to multiple stakeholders, such as the researcher, institution, and funder of predatory journals? Sort of moving across now, looking very briefly at sort of quality assurance. And if we look at audits, for example, and we look at sort of journals and publishers, we look at data transparency, we see that the top guidance, which has been endorsed by literally thousands of journals, there may be different levels of introduction regarding data transparency across 4 different levels. And the question is, how are journals actually doing? And how has TOP been implemented in these thousands of journals that have endorsed it? And these, again, are interesting questions, and there are many different ways to probably tackle this. Would be interesting also to know, have journals used similar sorts of implementation strategies? Are they effective? And is the effectiveness of top guidance in journals and publishers, does it differ by discipline? And really, this is also a question that I've simply used data transparency, but it could be for any standard that folks might be interested in researching. So how do academic institutions do for data transparency? What do we know about funders and data transparency? Are they auditing how their grantees are doing? And again, does that change? Do grantees at different career stage? Is there gender differences between how these standards might be implemented and by whom? And lastly, I'll just touch upon reporting guidelines. The question remains, as recently in a BMJ, is whether reporting guidelines are effective. One can ask this at many different levels. We know from the Equator Network that there are over 400 reporting guidelines. Are they all developed according to a similar standard? And these are questions that definitely, again, could be asked. There are similar sort of questions. Do journals post results on, if journals have published 1,000 papers, how many of those papers have used a reporting guideline? Do the guidelines improve the quality of reporting, or do they actually make them worse or not? So these are the sort of questions that I've sort of just been thinking about, and no doubt there are many, many other questions. I'm going to stop my presentation now and to open for any questions.
Thank you, David, so much. I'm not seeing any specific questions coming in from attendees on your presentation, so I thought I would.
Michael, there's one.
Oh, very
Look
good.
at the very bottom.
Can you read it? Because I'm not seeing it.
Yeah, from Ahmad Badar. Some preprints have led to controversy. Old generation of editors, I don't think he's referring to any of us, probably are not happy with the trend. Can you comment on that, David?
Well, I think that the trend of preprints is, a dramatic increase in the number. So I don't think that they're sort of going to go out of fashion. And although, some of us think of preprints as are quite new, I would refer those to a beautiful editorial or comment from Matthew Cobb in PLOS Biology, that they do, preprints do have a long history dating back to the 1960s. So I think the pandemic has shown at least that preprints are here to stay. And I think your question could be the sort of question that we might want to entertain to see in the peer review Congress. Do younger editors feel differently about preprints than less young editors? And we also need to know whether editors, whether preprints are sort of, in quotes, doing their job, or whether there are some issues about preprints that we ought to be aware of.
Thanks, David. Let me follow up on that, because one of the jobs of preprints, at least as it was getting teed up for the medical community, was that not only rapid distribution of information that might be useful to the public health, but also that the community of investigators and clinicians could pool together with the open report and help people develop that for publication. So that was the model, as you know, out of math and physics from the 1960s, that people worked as communities of scholars together on developing the ideas. And then there was a final version that kind of made it into the article of record. Are you seeing that that's happening? I know COVID-19 hasn't left much time for that. It's created a tremendous urgency around preprints related to the pandemic. But I'm wondering what your thoughts are about that, because I just wanted to know whether you've observed that in your shop.
I've not seen that, Michael, but it may reflect my inability to sort of to keep up with this literature, which is just grows by leaps and bounds every day. What I will say, though, is that what's very interesting is, first of all, funders have said that there is a very active place for preprints, and they see it quite positively. There obviously has been a controversy in Australia with one funder sort of not allowing preprints, but I think by and large, most funders from around the world encourage that. I also think that there's some very positive move that journals are, by and large, welcoming preprints. And for those who are sort of wondering about whether your journal, whether a journal will accept a preprint, I would encourage you to go to look at Sherpa Romeo, and you can actually see the policies of journals about the utility of using preprints prior to submission.
We'll try and put that link into the chat so people have access to that. Okay. Given your focus on reporting guidelines in the prior presentations, I was intrigued by the Conserve report, which kind of tries to provide researchers some leeway in in conducting clinical trials in extenuating circumstances. I just wonder whether you could comment a little bit more on that.
Well, I think that that was an initiative that I was involved in, and there was a sense from a broad community of trialists that the pandemic had sort of really put a dent in how do we continue trials. Trials had to stop recruitment, and also that some trials, that even when they resumed recruitment, they had to resume it in somewhat of a different manner. And so rather than sort of have have people sort of wondering about how to deal with those issues, we thought it might be useful to provide some sort of guidance about how authors could be transparent in how they've dealt with the circumstances such as COVID. But there are other extenuating circumstances, but the most recent one that we see is COVID.
Excellent. I'm not aware we have more questions coming
Michael,
in.
I'll read one, and then I think we should move on.
Okay.
This comes from an anonymous attendee. It's a provocative question. Do you think that the misinformation was caused more by journals or preprints? Maybe mainly the predatory ones, David.
Right, that's a really great question, and I think that would be a great examination. What I have seen anecdotally myself is that there has been misinformation both in preprints and in the published literature, and that may reflect lots of different things. One of the issues I feel myself is that we haven't had enough focus on training of peer reviewers, and that we're really quite keen to involve people in doing peer review. But it seems to me that we might want to have some very formalized training of peer review.
Back to you, John.
Thank you, David, and thank you, Michael. Our next speaker is Theodora Bloom. She will talk about testing of innovation in peer review and publishing. Theo, the screen is yours.
Thanks, John. I'm hoping that you start to see my slides and that you can hear me. I'm going to talk about journals, publishers, and researchers, and how best we can research peer review and publication together. I will be slightly tongue-in-cheek to deal with my imposter syndrome of following David Moher and then trying to talk about how we should be doing research. So in terms of my relevant interests, I think the fact that I'm employed by the BMJ and that I'm a founder of the medRxiv clinical preprint server are the most relevant today. And this is my stereotypical view of how researchers and publishers talk about research in peer review. Publishers say we experimented with open peer review when they mean we tried it for a bit to see if we liked it. Whereas researchers will do a thorough and detailed assessment with a proper methodology, and they might come up with the sort of diagram from a nice paper by Tony Ross-Hellauer that tells us there are 14 different flavors of open peer review. So please be clear when you talk about it, what you mean. And one of the reasons we publishers are rather disinclined to do real research is because it's very hard work. And this is a paper from long before I was at BMJ, but when some of my colleagues had to develop a quality instrument. If you're going to say peer review did or didn't help a manuscript, how are you going to know? And this was a sort of baseline study to say, here's how we're going to judge the peer review. And the sort of results it came out with, and I mention again, even though this is a very old study, if you send peer reviewers papers with errors in, they find some of them. And in this instance, I don't want to argue with David about training, but training had very little effect on the ability of peer reviewers to spot errors. That's a specific question about peer review. Does it spot errors? And whether you think this is a good or a bad news story depends whether you think it's good that peer review found some of the errors or bad that it found a minority of them. And of course, when it comes to really believing the results of any single study, we want the kind of meta-analysis and synthesis of results that's come from this study, which is also predates the previous peer review congress, that told us really most training doesn't improve the quality of peer review reports, but having a statistical review, it does. It is possible to really research these things, but the number of studies that have been done so far is very small, and most of the studies are still rather old. Meanwhile, at the BMJ, we do have open peer review of a flavor. We post the full peer review history of an article, including the reviewer's identities, but we only do this for accepted articles. And we also have post-publication peer review. And we do that because the research suggests it isn't any worse than the other variety, and we think it helps with conflicts of interest and other issues. But again, it's a combination of what the research shows and what we kind of feel is the case. Switching to talk about medRxiv, which has been mentioned, so I think people know it's a preprint server owned and operated from Cold Spring Harbor Laboratory, but managed in partnership with BMJ and Yale, and which happened to launch. It came out of very vigorous discussions at the last peer review congress, but launched just before the pandemic took off, really, and so it has been very prominent in the pandemic. And we launched not as a research project, but as a service, and so we haven't done the research, but luckily others have, who then they have looked, for example, at the different quality of reporting between preprints and the published research article that followed them, and come up with very detailed findings. We've talked about waste and the fact that, you know, COVID is the first time we've had an epidemic, or in this case a pandemic, for which we had research about it come out really very quickly as soon as the issue was being discussed, really. Whereas in the case of Ebola and even Zika virus, most research on them didn't get published, made public, until after the problem was largely solved. BMJ is also, like many other people now, looking at living systematic reviews as a way of presenting up-to-date information. For example, in the case of drugs for COVID, we're combining that with an approach to rapid recommendations to try and have recommendations disseminated much more quickly from research finding to clinical guideline. But again, we're doing that as a publisher and not as researchers. We don't know whether actually this helps people get information translated into clinical practice more quickly. We will hope to know those kinds of things. And I suppose part of the struggle is when, you know, for me as not a researcher in this field, when I try to read a study protocol for methods of the conduct and reporting of living systematic reviews, and I'm looking at a protocol for the methodological survey for the methods of reporting systematic reviews, I need to get my head into a different space from my usual publishing job to be able to really participate in that. All of which is really a way of saying I think it all works better when publishers and researchers work together. At BMJ, we're very lucky. We work with a researcher who is entirely interested in these issues, Sarah Schroeter, who I hope will be able to present at the Congress, and she helps run a PhD program where people are studying exactly these sorts of issues. But like many of the journal editors, we face lots of problems about confidentiality agreements, technology issues. How can we allow researchers to study more than one journal at once at different publishers and so on? So I think it's a plea for us to work together to bring the strengths of both groups to give us the best results. And I really look forward to seeing all of that outcome of that sort of research at the next peer review congress. Thanks very much.
Thank you, Tia. Michael, do we have any questions?
We have one, and this is an opportunity to ask some past ones, or we can wait till the end. Theo, how do you manage the post-publication peer review report? Do you require authors to respond and revise published articles based on the post-publication reviewer comments?
So we, in general, if it's a discussion, if someone posts a question about an article that requires a response from the authors, we ask the authors to reply as a comment. If a really critical issue is raised during that discussion, it can occasionally lead to a correction of an article or something like that. But often it's really a way for people to have a sort of, by the way, we found this too, or we found something else a bit related, or, you know, those kinds of discussions which aren't necessarily really doing the same sort of job as the initial peer review.
A follow-up, if peer review training of junior and senior staff is ineffective, do you think peer review training should start at an undergraduate level across scientific disciplines?
Well, I suppose the issue, so I did present these to be provocative. One issue is, what is the training meant to pick up? So I would say if you're training people to be a statistical reviewer, and we know that statistical reviews work, then you're doing something right, and you'd be glad of that training. If you're trying to train people to spot errors, that's clearly a different thing, and yeah, probably that should start at an undergraduate level or before. Certainly journal clubs and things that help pull apart papers were part of my training. And I think it comes back to that, what do we mean by peer review? What are we asking them to do?
And one more, and then we'll wrap up this section. For the BMJ study Theo mentioned, I remember I stopped checking for further problems after identifying a couple of fatal design flaws. So on the whole, I might be scored badly by counting how many flaws I identified. Do we need to identify all flaws or just focus on key problems in the process of peer review?
Yeah, that's a great point, because if reviewers find something that completely undermines a paper as a whole, you would expect them to write to the editor and say, look, I'm not going to go all the way down this paper because it's quite obvious that the methodology is flawed from the start. And so that's a critique of our study design, right? I mean, maybe there should only be one major flaw and 8 minor ones. And if you don't find the major one, there's a problem. So. Yeah.
And that would be from our perspective, I think, and in this house would be a great peer review if a external peer reviewer helped us identify fatal flaws.
Exactly.
So thanks very much. I'll hand it back to John.
Thank you, Theo, and thank you, Michael. Let me share my screen. If I can find the slides. Okay. So this is a call for research and abstracts for the 9th PRC, and I want to offer some guidance and some comments on what we're looking for you to submit. Abstracts summarizing original high-quality research on any aspect of peer review and publication are welcome. Anything that is related to the contact, reporting, assessment, and dissemination of scientific research is welcome. No limitation for study designs. Of course, we have preference to well-developed studies with more generalizable results, for example, prospective, multi-year trials. The perfect study will never happen, but control studies are something that we like. Collaboration is something that we like. Collaboration could involve researchers, journals, publishers, funders, and information disseminators. Retrospective studies, systematic reviews, meta-analysis, bibliometric and other data analysis, surveys, modeling studies, and other types of studies will also be considered. It has to be new research and findings will be given priority. And we also encourage studies that build on previous related research. We particularly encourage research that crosses disciplines and work that aims to provide valuable insights across disciplines. If you have research that has been previously published, this will not be permitted to be submitted unless you have some new unpublished analysis, something new to say. And abstracts that describe narrative reviews, expert reviews, recommendations, and opinion will not be considered. The range of topics that we consider is really vast, and I have to say that what I'm going to show you in the next few slides is not inclusive. We really look forward to some topics and some ideas that we have not even thought about so far, because this is a field that is moving very rapidly. Within a year from now, I think that the whole field may be completely renovated and perhaps destroyed and reincarnated and rebuilt. So bias is a key theme. Efforts to manage or eliminate bias in research methods, contact and reporting of research and interpretation of evidence, publication and reporting bias, bias on the part of researchers, authors, reviewers, editors, funders, commentators, consumers of scientific information, all sorts of interventions to address gender, race, and ethnicity, geographic location, career stage, and discipline biases in research dissemination, and efforts to improve and measure diversity and inclusion of authors, reviewers, editors, and editorial board members. Editorial and peer review processes are also very important for the conference. So assessment and testing of models of peer review and editorial decision-making, workflows used by journals, publishers, funders, and research disseminators, evaluations of the quality, validity, practicality of peer review and editorial decision-making, quality assurance issues, editorial policies, responsibilities, freedom, integrity, grant proposals. It's a whole different world, but we want to hear about it. Peer review of content that is submitted and selected for presentation at meetings, and effects of an adoption of the COVID-19 pandemic on reporting, quality dissemination, quality control, equity, editorial workflows among journals, publishers, and other stakeholders, including, of course, social media and news media. Another major theme surrounding work on research and publication ethics, ethical concerns for researchers, authors, reviewers, editors, publishers, and funders, authorship, variance thereof, contributorship, accountability, responsibility for what people publish, conflicts of interest, research and publication misconduct, ethical issues for review and for approval of studies and for other sorts of investigation, confidentiality considerations, rights of research participants in scientific publication, effects of funding and sponsorship on research and publication, influence of all sorts of stakeholders who are external to the process, but they may really run the show in many situations, including some that are more visible and others that are less visible, tools and software to detect wrongdoing, such as duplication, fraudulent manuscripts and reviewers, image manipulation, corrections, and retractions. Another major issue is how to improve the quality of reporting. And in this field, that includes effectiveness of guidelines, various standards that try to improve the quality of reporting and publication. How do you evaluate quality? How do you improve data sharing, transparency, reliability, access, reproducibility checks, replicability, reanalysis, approaches for efficient and effective correction of all sorts of errors, and limiting the spread of retracted science, innovations to improve appropriate use of methods and statistics, assessment of artificial intelligence and other tools to improve reporting and its quality, innovations on how to display data and science and different types of scientific innovation, quality and reliability of dealing with images and presenting them, standards for multimedia and new content models for dissemination of science, quality and effectiveness of new formats for scientific articles, some of which may appear in the 1 year from now until the Congress. Next big area that we're interested in is, of course, models for peer reviewing and for publishing science. And there's already quite a bit of work that has been done, but more is being done, and we look forward to innovative ideas on different types of single blind, double blind, collaborative and open peer review, open and public access, embargoes, preprints, pre-publication posting, releasing information, reanalysis and reproducibility checks, prospective registration, post-publication review, communication and influence, evaluations of reward systems for authors, for reviewers, and for editors, approaches to improve diversity and inclusion in peer review and publication, innovations to address reviewer fatigue, use and effects of social media, quality and effects of scientific information in multimedia and new media, quality, use and effects of publication and performance metrics and user statistics, assessment of financial and economic models of peer review publication, advertising, sponsored publications, content tagging, markup, linking, artificial intelligence, and other types of software that may help or make things worse, perhaps, in peer review, decision-making and disseminating science. How do we deal with opportunistic, predatory, and pirate operators? Are there threats to scientific publication? Hopefully it will still be alive within a year from now, and the future within a year and way beyond. And then dissemination of science and scholarly information. How do we improve quality, efficiency, equitability, Can we use novel mechanisms, formats, and platforms to achieve that? New technologies. Are funding and reward systems making a difference in that regard? How do we use bibliometrics? How do we use alternative metrics to evaluate the dissemination of public science? Comparisons and lessons from various scientific disciplines would be very interesting to see. Mapping of different scientific methods and reporting practices and of meta-research across disciplines. Effect of the pandemic on scientific information, misinformation, disinformation, and everything that can go wrong. And finally, reporting of science, publishing, dissemination, and access during emergency situations like pandemics, natural disasters, and political turmoil. Sometimes we may have all of that. To close, I want to invite you to join us for a fascinating Congress a year from now, September 8 to 10, the 9th Congress. Hopefully, it will be in Chicago. It will be in person, and we will try to make it a success. And I want to thank all of you for making it a success by submitting your work. I think we can have also some final comments from Annette and then A and Michael. Annette.
Sure, thank you, John. And just very briefly to those of you, thank you for joining us. If you have not already begun your research, now is the time. So get your engines going. There have been a number of excellent proposals for research in both the Q&A and the chat, and we urge you to take those up. Instructions for preparing and submitting abstracts are available on the Peer Review Congress website at peerreviewcongress.org. The abstract submission and review site will be open for submissions on December 1 of this year, and abstracts are due by January 31 in the coming year. As John mentioned, we're currently planning to be in person with the option for virtual participation that is being worked out now. And I'll stop there, and I think I'll turn it back to Fee and Michael for addressing remaining questions.
Fabulous. Thank you very much, Annette. And great to have all those talks. Michael, how are we doing on the questions?
We have a number that came in throughout that were general. So I'll start to field them, and you should feel free to come in. You know, there were a couple questions, Annette, you responded to one about research that's in progress but won't be completed by the time of the abstract deadline submission. Can you address that generally for attendees?
Yeah, Annette, what's your advice to people in that situation?
Yeah. So because of the long time between when submissions are done and our process of reviewing and selecting abstracts, that is a legitimate question. I believe we on occasion will receive completely promissory abstracts. So those are not really likely to make it. But if there is an abstract that is reporting ongoing research or research that has just begun that fully describes the methods and the analyses to be done and can give us an indication of when those outcomes will be finally analyzed, and particularly if that date falls before we're going to make the final decisions, those are certainly permissible.
And by promissory, you mean those ones which say we're going to do this great piece of research and this is what we're going to do, and then at the time of the Congress, nothing has materialized. So that's
no, we don't want those, right?
We don't want those. Thanks, Annette. Michael, next question.
Yeah, an old friend of the Congress, Mario Malicki, wrote early, as the conference has in the past peer-reviewed submitted abstracts, are there any plans to have a trial or any other study type to test or improve peer review effectiveness of the conference itself? Turning the lens on the peer review Congress rather than just on peer review.
Oh my God, could we bear that? Who should we ask? Well, I think David, let's have your views on that first of all. Should we evaluate the Congress? Yes, we should. How?
Of course, yes, we really need to be able to shine the light on ourselves and how we conduct ourselves, and whether the methods and processes we use are as effective as we think they are.
John, how would you do that?
I think I'm very open to ideas, including randomizations. I'd love to become a guinea pig for science of this sort. So whoever wants to do something with us, in a way, please do get in touch. I cannot promise that I will take any intervention, but I think I will be open to most.
I think, how about randomized attendance or non-attendance, and then we'd track people's career paths, 10 years later, have they advanced or disappeared from view? How about that? But I think we should be looking at something of that sort, something to show that the value of what's been going on. Michael, next question.
There are a cluster of comments about that are both practical and research oriented about getting people to peer review. What should be measures for making peer review more rewarding, considering that there's obviously no payment? What are reasonable incentives? I'd like to hear from the panel or others how to incentivize thorough, thoughtful reviews or simply participation, with a comment about Publons still not widely recognized among scientists. How can we spread the word and encourage willingness to participate and increase the reputation and the academic value of peer review?
Great question. Veronique, how do you feel about that on PLOS, about how you reward and motivate your peer reviewers?
I think one of the steps in that direction, I mean, I completely agree with the commenter that peer review is an incredibly important activity, and it's yet to be recognized as a bona fide academic contribution. You don't typically see that evaluated in tenure and promotion committees and things like that. And I think that is a major issue. The entire industry is dependent on the quality of peer review, and it's not incentivized in reviewers. So I think it's really, but it's an ecosystem sort of problem, because it's not just from the side of the journals. I think it's also in terms of, as I mentioned, review and promotion committees and so on. So I think that a first step in that direction that we've certainly taken at PLOS, and we weren't, I mean, others have started that way before we did, but we've seen really great adoption is in actually publishing the peer review reports, because at least there is transparency on the quality, because it's also not just, as we've said multiple times, not just a number of times. It's not the number of reviews you do, it's actually the quality of reviews. And if it's all in a black box behind the scenes, nobody sees the quality of reviews. So I think publishing peer review reports is a first step. I think there are huge questions about and real benefits and real concerns about anonymity in peer review. So it's not the simple answer, because I think people are still quite hesitant to reveal their identity as reviewers, sometimes for very good reasons. So I think it's a really difficult problem, and it's a problem that will require systems sort of solutions to that. I would argue that having the peer review available and citable and readable by others is a first step, and it's obviously not sufficient, but it's a step.
Thank you. Thanks, Veronique. Annette, are you aware of any studies on incentivizing peer reviews and whether that improves the uptake and quality of reviews? Sorry, you're on mute.
Yeah. We've seen some over time about incentives of various types. Everything from cash to non-cash. And I'm sorry to say, nothing seems to really work. That's not to say that we haven't found the right thing to test.
Great. So there's some projects out there, all sorts of different incentives could be offered. I remember historically one of the journals that the BMJ publishes, they had CDs that the editor would send out if you sent in your review within 10 days. You got a classical music CD. I don't know he did it as part of a study, but there we go. That sounds very old school, doesn't it? Wouldn't work anymore. Michael, other questions?
There's another question about diversity, equity, inclusion. So maybe this starts with Kat. A commenter says, I really think we need to think about solutions to address lack of representation differently from the way we think about solutions to bring equity to scholarly peer review and publication. Any thoughts about that?
Absolutely. And I think this is again, I keep using the word tension, but I think it's a tension that a lot of these organizations are experiencing, because I think there's the kind of organizational work that we need to do internally to address diversity and inclusion within our organizations, within our culture, within our recruitment processes for editorial staff, and then more widely editorial boards, which is kind of one focus with quite a lot of evidence that we can import from other industries and we can learn from. And then there's sort of this separate stream of work, which is very much focused on the kind of way we interact with our scholarly communities and the editorial and peer review processes. And I think it is quite important to keep those kind of psychologically separate, because although they inform each other, the interventions are quite different. So yeah, I thoroughly agree.
Thanks, Kat. Other questions, Michael?
There's a somewhat focused question. Maybe this should go to John as a representative of metrics, because it's really about clinical trial design, but it's acknowledging the shift of clinical trial conduct to decentralized investigations, where participants never see an investigator. They're recruited online, have things, meds or devices shipped to their home, and report things via online surveys, and wondered whether, I don't know whether this is discretely a peer review Congress type question, but the issues that arise in those kinds of clinical trial designs. I don't know whether John wants to take that, or David, or we'll say, let's study that for the peer review Congress next year.
Clearly, we see a lot of the ingenuity in clinical trials. During the pandemic, many people felt that clinical trials were dead and buried, but I think that we saw that they could be probably one of the most successful designs and most efficient designs in terms of having large adaptive trials that were run within just a couple of months and gave very reliable answers on the effectiveness of multiple interventions, both effective and ineffective ones. So we have new designs, we have new platforms, we have new ways of recruiting participants, of collecting information, of different types of interaction or lack of interaction. I think we can learn from other disciplines. There's many other scientists who run randomized trials, A/B trials, for example, in the tech world are dominant. People run thousands of such trials. And I think we can learn from different types of experimental investigation. Which of them are transferable? How do you optimize them? How do you review them? How do you deal with all these delicate issues that are involved in clinical trials and experimental intervention? So I think it is relevant to the Congress, and if people have ideas about how to assess, evaluate, review, and optimize such technologies, I think that they're welcome to submit ideas and projects and abstracts.
David, did you want to add to that?
Just to add that I think it's the questioner has a great research agenda that would be nice to see submitted.
Thank you. Can I, Michael, can I just build on one of the things I was very struck by in reading out the list of disciplines that the Peer Review Congress wants to reach out to is, anyone viewing this will realize and remember that this came out of healthcare, this medicine healthcare, this peer review Congress initiative, Drummond Rennie launching it from JAMA and others getting involved. But the actual aim is to really try and include, disciplines all right across science, technology, engineering, medicine. I just wondered how realistic that is, and how, it's interesting, John, you have a great background in maths, and are the systems sufficiently the same, and can we really genuinely learn from each other, and how big a step have we got to take to get this Congress to really embrace those other disciplines? It's a kind of question for, well, let's say Annette and John in a way, but others might take a view. John, what do you think?
I think that we should embrace everyone. I can't think of any scientific discipline that is not welcome to the Congress. We all use the scientific method in different ramifications and in different ways of applying it. And in my experience, I think the best ideas typically come from outside of a discipline. A discipline usually has saturated itself and probably has become too acclimatized to the way that things are run. So we want disruption, and disruption may come from outside. If you have disruptive ideas, no matter where they come from, where they can be classified, or even better, if they cannot even be classified yet, please do send your abstract to the Congress. I think that if we manage to get people from very different scientific fields to join us in Chicago and or virtually, it would be amazing.
Annette, thank you, John. Annette, what's your view on that?
It's been a challenge. It's been a bit of an uphill climb for us. We did start in biomedicine, and it took us a while to mature. The first 4 congresses, the research were actually published in JAMA, the best, and then we realized that the research had matured and could fly on its own and be published in any journal. And so you're seeing that. Last time around, we've got quite a few abstracts from various sciences that were conducting work that had been done maybe 10, 20 years before in one of the other disciplines. And so this time around, we are asking for researchers in any discipline to take a broad look at what's been done before and to acknowledge that work. And so even in the abstracts, we're allowing people to cite references, which we haven't done before, so they can build on that.
Great, thanks. Michael, any last, probably time for a final question, have we?
All I'll say is that as John acknowledged in his first slides, any questions that we haven't answered, we will try to type out replies to. We may even do that for questions that have already been answered in the recording. So just be a little patient and we'll try and get you replies and answers, and check back at peerreviewcongress.org for a video version of the recording of this. And thank you everyone for attending and for your contributions to the conversation.
Thank you, Michael. I will say my farewell and thanks to everyone, the colleagues on this call, colleagues not on this call, and looking very much looking forward to seeing people in Chicago and get going on the research. Annette, perhaps we'll pass on to you and you could pass on to someone else to say goodbye.
Just wonderful. Thank you to everyone here and to all the participants. We'll see you in Chicago. We'll see you via email between then and now and any other virtual way we can imagine. So thank you all.